Hello, how are you today? Welcome back to the channel. I pray that you are having a great day and that you are in good health. So, I want to start the conversation off today with reminding you that the last video I shared with you my symptoms that I had that started me on my uterine health journey. And today I want to discuss my first doctor's appointment, the ultrasound, and the results from the ultrasound. And if you need a refresher from, how it all began, or you're new here, I highly recommend that you go back and review the videos that are there. So I also like to start with a disclaimer because I think it's important for people to know that I am not a doctor, nor am I a medical professional. I am a woman sharing her uterine health journey in hopes that this sparks conversation amongst other women. And, we're talking to our younger women, hopes that this encourages women to know that they are not alone and if they are on this same path and journey. And hopefully it encourages women to make an appointment if they too are feeling some kind of symptoms and maybe they're nervous and scared. So, uterine health, let's talk about it. So, picking up from the last video, my appointment with my doctor was February 12th of 2025. And that was already pre-scheduled. That was my annual exam that I normally have. And so it was just perfect timing that it was, aligning with the symptoms that I had starting in January of 2025. And so, as I previously mentioned, I had already sent my doctor via the patient portal the symptoms that I was having of spotting blood. But I'm very grateful that I take good notes and I was able to have in person at the doctor's appointment with my doctor to be able to speak on the symptoms and how I was feeling and things of that nature. Some things you just can't really convey. You can, but it's different, I believe, in person. In-person communication is always better. So it's always best if you can have it. So I had my regular annual exam and everything went well, thank God. And my doctor suggested that I have an ultrasound appointment so we can, start the step one to figure out what could potentially be causing the spotting and the bleeding. So my ultrasound appointment was scheduled for March 5th of 2025. And I remember it well because it was Ash Wednesday. As I was passing the chapel, they were, putting ashes on people's, foreheads and things of that nature. And I want to take the time to give you a very detailed, transparent experience of what I experienced for this particular ultrasound. And I do this because I don't, for you to, I don't know what you know. And hopefully this can help you, manage your expectations and not be scary and things of that nature, and just know what happens when you go to have an ultrasound. And so I wrote down exactly what ultrasound that I had. So my doctor scheduled an ultrasound, a pelvic, transabdominal, and a transvaginal and ovarian Doppler ultrasound. So that is what I had. And I want to say this too. It's important to ask questions when you're with your doctor. Like, why am I having this test? Why did you suggest this particular test? And, what's going to happen to it. But I always like to know the name of it. And if you don't know how to spell something, I'm very keen about saying, can you spell that for me? So this actually helps me because when, of course, I went back home and did, some more research on the procedure name because I wasn't familiar with ovarian Doppler. So this can also help you when you do your own internet research as well. So a lot of time I'm talking to you is usually from some of the internet research that I did because I just wanted to kind of understand quickly what was, going to happen. And also, when you make your appointment, the scheduler that you're talking to and via the patient portal, once your appointment is scheduled, if you use the patient portal, they're going to explain how you should prepare for your ultrasound. And one of the things I remember being instructed to do was to drink water because they wanted to make sure that your abdominal, your stomach was full of, liquid water. So it is important to have a full bladder. I'm looking at my notes because I did Google that. This is part of my Google research because I was like, why do I have to have a full bladder? Well, your Google research will tell you too. So it's important that you have a full bladder because from, like I said, from my intense research, having a full bladder allows for clear and detailed images. And that's exactly what you want. You want them to get the best quality images they can have. So they're going to instruct you to have a full bladder when you come. So again, my doctor scheduled an ultrasound pelvis abdominal, which is going to measure and take imaging, which is why you need to have a bladder, your full bladder of your abdominal stomach area, right? And then the next part, so I'm having a two-part, and the next part is a transvaginal and ovarian Doppler. So that's when they go the vaginal. I'm probably saying it wrong. Transvaginal is when they actually look closely at your uterus and to see what's going on with your uterus area. And when they do the ovarian Doppler, that is, that's something while they're doing where they're already looking at your uterus, they can do that one as well. And through my Google research, I found that the ovarian Doppler primarily is used to evaluate to see if there's any kind of ovarian masses and things of that nature as well. So that's why I say it's good to have these names, because you can do your own research. Doesn't mean that it's law, but at least it gives you some kind of, idea of what your expectation is. So once you get, to the appointment and you check in and they call your name, you're escorted back to a changing room with lockers. And since I knew I was having an ultrasound in the lower half of my body, I wore a two-piece, like a sweatsuit or top and bottom. I don't remember what I had on that day. And some of them will say, just change lower half. Some will say, we want you to take everything off, but you can keep your bra. So it just depends on them. For me, although I did have a two-piece on, they did give me a gown. So I was like, that's fine. And they gave me the hospital socks. Yay. I guess those are my gifts. And then after you are, fully dressed in the gown, then they take you to a waiting room. And then once your technician is ready, you're escorted to that room. So when you walk into the room where the technician will be performing the ultrasound, it is like a little dark in the room. So your eyes may need to adjust, and they do have low light. I mean, you're able to see, but I just want you to know the lights are not on. At least when I went in there, the lights were not on. They were low lights. And so you start off with lying down on the table, a typical table that you would have in an examination room. And the technician puts some kind of gel on your stomach, and it can be pretty cold. And I think they do warn you about that. And then they take like this wand, like a long wand, much like those guns you see when you're checking out, but it's made like that. And they kind of like move it over your stomach and abdominal area. And then they're taking images and measurements of your abdominal area. So that was the first part of my ultrasound. I'm going to be honest. Sometimes I look at the screen too, if I can see it. Kudos to them, because it just looks like space to me, a bunch of white and black stuff. So I don't know what I'm seeing. I'm just trusting and believing that, they seem to know exactly what they're seeing, right? And so once the abdominal part is done, they usually give you a towel for you to clean yourself up, and then you go to the restroom to release your bladder and urinate, pee, so that it's a good thing for me too, so that you can no longer have a full bladder for the next part of the exam. And so when you return for the second part of the exam, the ultrasound begins. The transvaginal, I hope I'm saying that right, transvaginal begins. So what happens is they have this long probe, and they usually put a protection over it. So it may be like a latex condom or something like that. So if you're allergic to latex, make sure you let them know when you make your appointment or when you check in. And then so they put that there, and then on top of it, they'll put a little additional gel as well. And when I was doing my research, I'm trying to make sure I get this right. The purpose of them is putting that gel on top is to make sure for for entry into the vaginal cavity, and to also make sure they get very clear imaging of what's going on in your uterus. Yes. So when they enter, so I don't know if I can do this. I'm going to do like this. When they enter, the long probe is going in, to your cervix area right there. But it goes up a little past your cervix up into your uterus area. And I'm going to be very honest, this part may be a little uncomfortable for you, and maybe even a little painful, because when they put the probe in and they're moving around, they're not rough with it, but they are moving around. And it's an area that's normally not probed, so it's very uncomfortable. And they may move to the left, they may move to the right, they move like up, down, and around. And sometimes you can almost feel like the probe kind of really pushing on something, and I figure that they're trying to really get a good image of whatever they are. So they're going to go measure your left or your right. If you're feeling any kind of pain, it's important that you talk to your technician as well, because what should happen is the technician will say, well, I only need 2 more images on your left side, 2 more images on your right side. And if you can bear it, please let them get all the imaging that they need from you. A lot of times, once the exam is over, sometimes they will step away and look at the imaging. And if they have everything they need, you can go. Sometimes they might say, oh, I need a better imaging of this, this, and this, and it has to start all over. For me personally, I'd rather them have to, while I'm there, take it from the top again than to have to make another appointment to come back and 3-4 weeks later, especially when you're seeing spotting of blood, because I really wanted to know what was going on. So also I had a woman technician. I don't know if they have men technicians, but if you don't feel comfortable with a man, especially when you do the insertion part, then maybe you can ask to ensure that you have a woman technician. So after the ultrasound, the transvaginal ultrasound, they will give you a kind of a towel to wipe yourself up, and then you change. And again, unless they need to come back and do additional imaging. And then they give you the towel to remove the excess gel off of it, and then you're gone. So the whole procedure took less than 30 minutes. So you're not there long at all. And I just also want to say that you might feel a little bit of discomfort when you leave out of there, because again, as they were entering, it went further up and it's touching, parts of your body that, never gets touched. So you might feel a little bit of soreness and discomfort, but nothing too much. And I do understand pain can be unbearable, but I say, bear as much as you can, because you're on a fact-finding journey and you need to know what's going on. And this is just step one. I'm not telling you to endure a whole lot of pain. I'm not telling you to suffer in any means. Sometimes you'll go to the doctor appointment and they will let you insert it, or you can, insert with your hand if you're feeling very uncomfortable. But I won't even lie to you. I felt uncomfortable. And I did feel pain, but I sucked it up because I just wanted to know what was going on. I wanted to know the information as soon as possible. So that's what happened to me. So I'm going to try to post a few videos that I saw when I was, doing my research of what happens with this. Some of them are kind of medical, and they're not really for us, but then you can at least see how they're moving the thing, or the Doppler around. And the other thing is there's some videos that actually talk to you about what to expect as well. So I'll try to remember to put those in, and those will be in the description. So my doctor called me the next day with the results. It doesn't take long for, your ultrasound imaging to come back. And the ultrasound revealed that my uterine lining was at 11. And from my personal internet research, I discovered that when you're postmenopausal, your uterine lining should be at 4 millimeters, and mine was at 11. So my doctor strongly suggested that I go see an OBGYN doctor, which is a gynecology doctor, which, all things female. And if I couldn't get a quicker appointment, then she would do her best to get one for me. I really appreciate the urgency in her voice. It was professional. It wasn't alarming, but I can tell that she was concerned about it being my uterine lining growth being 11 millimeters. And since I had an urgency, I appreciate her having that same urgency as well. So I'm going to show you what I did in my brain, because I am a visual learner. And again, I go back online a lot to research stuff. Sometimes when you do your research, you might need to take a break because it can be overwhelming, all the research that you do. So hopefully you can see this. So on this little ruler, this is just a regular ruler. This is at the 4 centimeter spot. And I'm not sure if they measure it with a regular ruler, if they have some kind of medical ruler. So I'm not sure if your uterine lining is even this big. But I just went for visual. I had to do this. So this is 4 millimeters. So your uterine lining postmenopausal should be anywhere like this and smaller, or smaller, because it's shrinking. So it shouldn't, so it should be going down, 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 because postmenopausal means there's no more menstrual cycle. You're not having any more kids. So it's there. So when I did my thing, as you can see, mine is an 11. So that means it was this big in my mind, compared to it being like this. it was like this. So I'm going to bring this closer. And I used a regular ruler. Again, I'm not sure if that is the appropriate measurement, but at least helped me in my mind say, okay. And then on the different, sites, some says your postmenopausal should be 3 millimeters in this, but whatever it is, 11 millimeters is not a good sign, especially postmenopausal, because they want to understand why is it causing the bleeding, right? So thankfully, I had already scheduled my OBGYN appointment. And when I tell you things are aligning, that OBGYN appointment is a testimony of God's favor by itself. In 2025, I had made a commitment that I was going to start going back to see an OBGYN. I had stopped because I didn't have my cycle. But then I started thinking, you know what? I still have my full uterus. Everything is down there. I need to go and not just see my annual doctor, my primary care doctor. I need to go see someone that specializes in all things female reproductive and especially my uterus. So I went back to the doctor. So that is where we stand at this point, that my uterine lining was 11 millimeters. And my next step was to go see the OBGYN. So in the next video, I will discuss my OBGYN appointment and what happened during that appointment. So I hope this video was, both helpful, encouraging for you. And I know going to the doctor can be scary and you don't understand. They say you're going for an ultrasound. You're like, what is an ultrasound, or what kind of an ultrasound? Ask those important questions so that you can make yourself feel secure. And again, when you do your internet research, everything isn't solid and gold, but at least it gives you an idea of what you can expect. And it can, kind of manage any kind of fears that you're having or anything like that. So I encourage you to, make the appointment, if you're feeling any kind of way. And again, I hope this was encouraging to you. If you have any questions or any comments, please feel free to leave them down below. I do respond to comments. I will answer questions. Also, feel free to share this video and all the other videos that you have. Don't forget to like the video. I think if you like it, it pushes it out more. And I want this pushed out because I want us to have these uterine health conversations. And I want people to, if they're in their search, that they can find me. Not that I'm an expert, but at least I'm a human being sharing my journey. Like I said before, a lot of stuff I see on there are from medical. I don't see a lot of women speaking about their journey. So that is my purpose. And then also when you subscribe to the channel, select the notification bell so you know when I'm going to be posting videos, because I will be posting a lot of videos, sharing in this uterine health journey. So until next time, take care. And again, thank you so much for watching these videos. And I pray that you are in perfect peace and perfect health. And I pray that you are learning and something from these videos that I am sharing with you. Take care. Until next time, be well.